In this lesson, we will make an overview of public health problems in developing countries. Developing countries face a wide range of public health challenges that are often exacerbated by limited resources, weak healthcare systems, and socioeconomic inequalities. These problems significantly impact the quality of life, life expectancy, and overall development of nations. Below is an overview of the major public health problems in developing countries, their causes, and their implications. Communicable diseases remain a leading cause of morbidity and mortality in developing countries due to inadequate healthcare, poor sanitation, and limited access to vaccines and medications. Key issues include HIV/AIDS, with sub-Saharan Africa bearing the highest burden due to limited antiretroviral therapy access, malaria, which disproportionately affects children and pregnant women in tropical regions, tuberculosis, driven by poor living conditions, and HIV co-infection. Diarrheal diseases caused by unsafe water and sanitation, and vaccine-preventable diseases like measles and polio, due to low immunization rates. Root causes include weak immunization programs, poor water sanitation, and hygiene infrastructure, overcrowded living conditions, and inadequate public health campaigns. Addressing these challenges requires equitable access to healthcare, improved sanitation, strengthened immunization programs, and targeted public health measures to mitigate disparities and reduce preventable deaths. Non-communicable diseases, NCDs, such as cardiovascular disease, diabetes, cancer, and chronic respiratory diseases, are rapidly rising in developing countries, traditionally associated with wealthier nations. Key issues include increasing obesity and diabetes rates driven by unhealthy diets and sedentary lifestyles, hypertension and cardiovascular diseases linked to urbanization and stress, high tobacco and alcohol use contributing to chronic illnesses, and limited awareness or screening for conditions like cancer. These challenges are fueled by urbanization and globalization, which promote lifestyle changes, weak healthcare systems unable to manage chronic diseases, and limited access to affordable medications and diagnostic facilities. Addressing NCDs requires strengthened healthcare infrastructure, increased public awareness, and improved access to affordable prevention, screening, and treatment options. Maternal and child health issues remain critical in developing countries with high maternal and child mortality rates driven by inadequate healthcare services and socioeconomic barriers. Maternal mortality stems from complications such as hemorrhage, infections, and unsafe abortions, while infant and under-5 mortality is often due to preventable causes like malnutrition, pneumonia, and diarrheal diseases. Malnutrition and stunting are widespread, affecting children's physical and cognitive development, and adolescent health issues, such as early marriages and pregnancies, increase risks for young girls. These challenges are exacerbated by limited access to skilled birth attendants and emergency obstetric care, sociocultural practices like early marriage, and inadequate nutrition and healthcare during pregnancy and early childhood. Addressing these issues requires improving healthcare access, promoting education, and addressing sociocultural barriers to ensure better outcomes for mothers and children. Malnutrition, encompassing both undernutrition, e.g. stunting, wasting, and overnutrition, e.g. obesity, is a major public health challenge. Undernutrition primarily affects children and pregnant women, leading to low birth weights, stunted growth, weakened immune systems, and higher mortality risks. Micronutrient deficiencies such as lack of iron, iodine, vitamin A, and zinc result in anemia, goiter, blindness, and developmental delays. Overnutrition, driven by urbanization and increased consumption of processed foods, has led to rising obesity rates. The root causes of malnutrition include food insecurity caused by poverty, conflict, and climate change, lack of education about balanced diets, and limited access to nutrient-rich foods and adequate healthcare. Addressing malnutrition requires improving food security, nutrition education, and access to affordable healthy foods and essential healthcare services. Poor sanitation and unsafe water are major public health challenges, driving the spread of waterborne diseases such as cholera, typhoid, dysentery, and hepatitis A. Key issues include widespread open defecation in rural areas, which causes environmental contamination, and poor hygiene practices, such as inadequate hand washing, contributing to disease transmission. These problems are rooted in inadequate infrastructure and insufficient funding for water and sanitation projects, as well as rapid urbanization, which creates overcrowded and unsanitary living conditions. Addressing these challenges requires investment in clean water supply, sanitation facilities, and hygiene education to improve health outcomes and reduce preventable diseases.